Thank you very much, Ted. It's a great pleasure to come to these meetings, and this is a lovely spot. Disclosures, we run an institute that carries out a surveillance of the scientific literature, and that is partially supported by the alcohol beverage industry. Ted wanted me to, let me figure out how to get the next slide up here. Return. He wanted me to get things up to date. So I don't know if you saw the Walla Walla Union Bulletin from yesterday. The crash darkens downtown. And I thought this was a fascinating story. It says a driver struck a street sign, knocked over a fire hydrant, then hit a wooden power pole, knocking it down, knocking out the electricity. The driver allegedly then drove away from the scene, and they found his front license plate that had fallen off the vehicle. And the best thing was the police spoke, these are all direct quotes if you want to check it. In the business, we call that a clue. Now, incidentally, they tracked the car down. He was leaking something out of the truck. They found the car. He was passed out in a field. They brought him in, but they couldn't charge him for drunk driving because when he knocked out the power pole, they no longer had power to run the breathalyzer. So in any case, here's that's yesterday, and now if I can find my button. Shift. Nope. Which button here? How about that one? Yeah. Today I'm going to briefly mention a huge amount of epidemiologic and basic science and metabolic and clinical data, and I think that in our business we call that a clue. First, I'm doing two things. I'll give you a very brief summary of what we've known through the years, have learned through the years, and then I'll try to give an update based just on data presented in the last couple of years. But a little background is that in 1974, when very few people, Arthur Klatsky being one, were beginning to realize that moderate drinkers tended to have less heart disease, Framingham was putting out a major report on risk factors, and they included this table in there. And they'd found out that people who were non-smokers and drank no alcohol had 16.3% had died in the first 24 years among the men. However, if they reported a half or more, actually one or more drinks, the risk was cut in half. Dramatic. One of the strongest risk factors. For heavy smokers, 28.3% had died in the first 24 years of the Framingham study, and you'll notice that even a little bit of alcohol, that risk was cut in half. Now, all papers from Framingham have to be approved by the National Institutes of Health. And so when they sent this down to NIH, they quickly wrote back, said, refer to only 3 major risk factors, remove all references to alcohol. Saying with all the alcohol abuse in this country, we must not say that alcohol prevents coronary heart disease. And then they add, if you must comment on alcohol, say it has no effect. Now this is, you know, they're so worried about the evils of drinking, as most of our government officials seem to be in North America and in Northern Europe. I like the response of Henny Youngman. When I read about the evils of drinking, I gave up reading. Now, nevertheless, we are dealing with a government funding, public prejudice against alcohol that it's very difficult to get funding for moderate drinking. You can get funding for studying abuse, but for studying moderate drinking is very difficult. And Ted knows this. All of us who've had to get NIH grants to support our research have had to go to all kinds of extremes. And I just wanted to say that on 2nd Avenue yesterday, I had a really good day. I collected $220 for alcohol research. Another historical moment was this publication in 1979 by St. Ledger and his colleagues, showing the relationship between wine consumption and mortality from coronary heart disease, ischemic heart disease. And at that time, Finland was right at the top and US was right next to them. And you'll notice that everything else, Ireland, Wales, Canada, English-speaking countries, all of them had the highest rates of coronary disease, and they drank the less wine. And at the other end, you can see that there were much lower rates of coronary disease and more wine in Italy and France and Switzerland. Now these are what we call ecological comparisons, which means that we're comparing countries and cultures, and this suggested that wine could be imported, but what we really need to do is to look within populations, because there are many differences between people in Walla Walla and people in France, and lifestyle factors. They speak French, for example. That may have some, who knows. But the important thing is that if you look within a population, you can begin to identify some of the true risk factors. And this was what was done. And by 1991, there's this publication that showed this is the odds ratio. If you're a moderate drinker, do you have increased risk of dying of coronary heart disease, or do you have a decreased risk? And it's amazing. By 1991, we had publications. Arthur Klatsky was in there with his studies from the Kaiser in Oakland. By that time, Framingham had been allowed to publish. But around the world, we see the same thing, that moderate drinkers have much less coronary heart disease. Now, at the same time, we were still seeing these changes. This was a little bit later than the first slide of countries. And at this time, you can see that Ireland, Northern Ireland and Scotland, we had dropped down some. We had started treating blood pressure and doing some other things and cutting down the fat a little bit. But at the very bottom, there's Japan. Now, everybody says, oh, sure, Japan. You know, the typical Japanese 60, 70, 80-year-old is not eating enough fat in his or her life to have a decent heart attack. I mean, it's very, very low-fat diet works. And also, as you've heard recently in the news, not eating works. You know, if you cut your calories down by a third, you'll live longer. And it isn't just it'll seem longer, you will live longer. And so Japan was fine. But look, next to that, France. Wait a minute, France was lower than all these Greece and Italy. No, nobody believed it. Nobody believed it, Serge. They were thinking that, well, first of all, the first argument, well, the French don't really have a high-fat diet. That's just the American tourists that are eating all this foie gras and cheeses and things. And so that kind of stimulated my interest. And my wife and I started to go to France and south of France every summer to on business to carry out research and to see what the French were really eating. And, you know, we're driving through Gascony, where we've learned that they have the lowest rates of heart disease in the world, just about. And this is what they're eating. I mean, this is a big pile of fat. This is the confit and the goose fat. And at every meal, you know, they're spreading fat all over everything. So, I mean, and it's since been shown that the French do have a high-fat diet. Then the next argument was, well, the French can't diagnose heart disease. They just imagine that, you know, this farmer's working the field, and he suddenly clutches his chest, and he turns purple, and he drops dead. And the doctor comes in, his liver got him, you know. We didn't think they knew how to diagnose coronary disease. You know, the argument was, you know, they don't even know how to make a proper army knife. You've seen the French army knife, I assume. Nothing but a bunch of winos. I mean, what do they know about it? But then along came studies, and they made the French count in English, and they made it using the same criteria. And guess what? The French do have lower rates of coronary heart disease, considerably so. And to straighten this out, in coming on his white horse, galloped Serge Verdun. Serge was the first scientist in France to really say, look, it is true that, you know, wine may be playing a role, alcohol may be playing a role. He was the first one that brought science into this argument. And we've began to do research on the determinants and the mechanisms by which they may affect heart disease. This was picked up, as you know, by Morley Safer, and in 1991, actually, he did a segment on 60 Minutes called The French Paradox, and that during that session, he described the much lower death rate from heart disease among the French. And the best thing was he ended up holding a glass of red wine and saying the protection of the French from heart disease may be in this inviting glass. Americans went crazy. You could hear the cheers in Boston all the way from Napa Valley. I mean, wine sales jumped up 40% immediately, and wine sales continue to increase. And as of last year, if you ask Americans what is your preferable type of alcoholic beverage, wine is now number one. It's past beer. But I think more important, it became politically correct for scientists to describe not only the harmful effects of alcohol abuse that we've been hearing about for all centuries, millennia, but from the beneficial effects as well from moderate use. Since then, consistency is amazing. There's been nothing more consistent in epidemiology and any biological sciences as the hundreds of prospective studies that show almost uniformly that moderate drinkers of any type of alcohol first have much lower rates of coronary disease, and some studies, especially those in Europe, have shown the protection of wine. This is a summary of the relation between alcohol and coronary heart disease, and just a couple of points here that in comparison with non-drinkers, you see drinking a little bit comes down. 20 grams is the lowest point in this particular meta-analysis, and this is based on high-quality prospective studies that they were able to exclude ex-drinkers. So it's a very sound relation shown here. And at 20 grams a day, you have about a 20% lower risk of coronary disease in this meta-analysis. Now, what people say, yes, but you can't encourage alcohol because of the dangers. Well, there's a pretty good safety margin. And you may put this up against some of the drugs that we've been hearing about. You can see that you don't get back to the risk of a non-drinker until you're taking in, 72 to 80, you're taking 6, 7 drinks a day. I mean, there's a fairly good margin of safety there. And these are averages. Obviously, each individual varies, and you cannot take a single value from an epidemiologic study and apply it to an individual patient. But it gives you the feeling that there is a considerable safety margin for alcohol in general, and as we'll see, much more so for wine. So what do the recent studies do? They confirm the lower heart disease, and just 3 studies from the last few months from 2009. The Zutphen study just reported that men followed for up to 40 years until death in the vast majority of elderly men, and they had repeated assessment of alcohol, so they didn't have to base on what they were drinking 40 years ago. Up to 20 grams of alcohol, so drinking a half, a typical U.S. being about 12 grams, was associated with 25 to 30% lower risk of both cardiovascular disease and total mortality. The Optimal study looked at people with left ventricular dysfunction after having a myocardial infarction. These are people who had really bad heart disease, damaged hearts, a large number of them, and you can see over just 2 years about almost 1,000 died. And they found that the moderate drinkers had 26% lower cardiovascular death and 24% lower all-cause mortality. One more study just reported this year. This is an interesting study because they're trying to tease apart the differences between higher socioeconomic and lower socioeconomic people. We know that if you're lean and healthy and don't smoke, you're more likely, and good looking, you're more likely to drink wine. So all of these things, it may be that the other factors that are associated with it. So they first of all, they said just without any of these adjustments for socioeconomic status and education, there was 50% lower death rates in these studies, in this study, and if they adjusted for all of the other things they could, including some particular ones, they found there was still a 28% lower death rate. And this was, I think, an innovative approach, which I had not seen before. They calculated what they call a propensity quintile, a propensity score. Now, this is the propensity for being an alcohol consumer. Now, who are the alcohol consumers versus those who don't? Very little. They found out, that they would tend to be less obese, they tend to be better educated, they tend to have higher incomes, they exercise more, and they smoke less. So they said, okay. Then they classified everybody, the drinkers and non-drinkers, into these quintiles, 2, 3, 4, 5 here. So these people are all lean and healthy. They're in the peak of health. And then they said, now what's the difference among these people in the peak of health according to whether they consume alcohol or not? And you can see that the moderate drinkers has a lower risk regardless of all these other factors. So this is another way of trying to control for these extraneous factors, these other lifestyle habits that may have some relation with living longer and having lower rates of coronary heart disease. Now, one point I think that has come out in the last couple of years is the strong effect of the pattern of drinking. And by that I mean, how frequently do you drink and do you binge drink or not? And we have a nice study came out from Mignardi last year comparing the alcohol intake and the risk of coronary heart disease. This is a meta-analysis of a large number of studies. And you can see that if you drink a little, your risk of coronary disease drops. If you're a regular drinker, in other words, you spread it out through the week, the risk stays down. If you only drink on the weekends, you get a little protection, but then it goes back up. Big differences between sporadic weekend drinking, binge drinking, and these are all, drinking the same amount on the average, but these people are doing a little bit every day, and these people are doing it all on Friday or Saturday night. And another study from Russell this year looks at what is the number of drinks per day, and they looked at the in relationship to myocardial infarction, and you see in comparison with a non-drinker, the risk is lower for those who average 1 a day and 2 a day. Now, if you're a woman, that's the dark ones here, you can see that you lose your risk above about 3 drinks a day, and then if you keep drinking up to 10 drinks a day, you have more heart disease. If you're a man, the crossover point is somewhere around 4 or 5. So it's the frequency, and we have a number of good studies that have shown that the safest thing is to take your weekly allotment of 10 drinks, 14 drinks, whatever, and put a little bit for each day. Spread it out. Small amounts on a regular basis is by far the healthiest measure. Another paper that was interesting by one of the leaders in alcohol abuse, Jürgen Rum from Canada, he calculated the deaths in Canada from moderate drinkers. He included everybody who averaged less than 21 drinks a week. He did not take into consideration how they drank those 21 drinks per week, and he came up with the usual thing that, look, among young people, there's an increased number of deaths, and among old people, there's a decrease. All of these deaths he attributed to, drunken driving, accidents, falls, suicide, everything. And then we said, but are these truly moderate drinkers? And he said, well, yeah, they average less than 21 drinks a week. But I said, how did they drink it? So he went back to his data, and he looked at binge drinkers, and he took out everybody who admitted to binge drinking. And look at that, you lose almost all of those effects. So moderate drinking should be defined not only by the average amount per day, but it should be how you consume this. And you'll see that almost all of the adverse effects in the young is gone if you exclude the binge drinkers, and the effects in older age are much more pronounced. Another recent paper that kind of points out the differences in pattern of drinking. It's a nice paper by Alan Evans from Belfast. He is comparing France and Northern Ireland. And he's comparing these two populations because the per capita consumption of alcohol is almost identical in these two countries. Almost identical total. The problem is that everybody drinks in this country and only about half the people drink in this country. Northern Ireland, Scotland, they have some of the highest teetotal rates in the world. Anyway, the other thing is that these people, 90% drink every day. And you can see the more you drink, the lower your rate of coronary disease drops. Now, in Northern Ireland, first of all, the people are drinking all on the weekends. They tend to be beer and whiskey and very little wine, and you do not get a clear pattern. So it's a very striking difference according to how you take the same amount of alcohol. Once again, just to summarize, drink regularly without binge drinking, and probably every day. Maybe Arthur or some others will talk. You know, the whole idea that, oh, I'm going to stop every Tuesday. I don't drink on Tuesday to let my liver recover. I don't think there are any data to support that, but we'll hear later on that. And I think that probably wine is preferable, although a lot of the studies show that, you know, we know that all type of alcohol is better, and we'll mention whether or not this is not unique to wine. So what are the mechanisms by which moderate drinking lowers cardiovascular risk? And this is a summary of what we've known for many years, that both alcohol and the polyphenols in wine favorably affect the blood lipids. And our former speaker has just gone through a lot of these mechanisms, especially HDL. In fact, in population studies, we can use the HDL level to find out if someone is telling the truth about drinking, because alcohol is the biggest predictor of what their HDL, the good cholesterol level is. If you drink a little, your HDL starts going up. If you drink more, it goes up even further. Coagulation and fibrinolysis, extremely important, because we now know that atherosclerotic plaque that you saw developing doesn't just keep getting narrower and narrower and narrower. It usually forms a clot or ruptures and blocks up, and then you need to dissolve it quickly, which is fibrinolysis. So you need to prevent the clots, and this is what alcohol and polyphenols do. And if you do develop some clots, dissolve them quickly. Direct effects, very important on the endothelial lining. We now have genes that are specific for alcohol effects and specific for various polyphenols. Many studies showing that if you take dogs and create heart attacks in them, if you've given them a little bit to drink over the preceding few weeks, their hearts work better. They don't go into sudden cardiac failure and die. Inflammation, you've heard some about it, is an important aspect that is favorably affected by moderate drinking, as we heard. And glucose metabolism is extremely important. Now, this is an old slide from Francois Boisset, and I'm showing it just because this is the endothelial lining, and here's this, as you've seen, the macrophage forming the clot, and then here's the clot, and then this is getting ready to plug up or rupture out and plug up this artery. These are the linings. The thing I'm showing is that everywhere there's a red mark, it's where, at the time he wrote this, we could demonstrate one of the mechanisms by which alcohol prevented coronary heart disease, in addition to HDL and LP(a) and all of these. Alcohol, as Serge was the first to show, blocks the aggregation of platelets, so they don't form this clot here and start leading to obstruction. They're blocked from stimulating tissue factors which go to thrombin. It blocks the cells from migrating, the monocytes from migrating down and lead. All of these things, all of these red marks are one of the beneficial effects. And if we updated this to what we know now, it would all be red. There are hundreds of different mechanisms that are continually, almost every week, a new mechanism by which either the polyphenols or alcohol can work. So not only do we know that people who consume alcohol moderately have less heart disease, but we know why. Now this is this just came out a few weeks ago. This is Collins' paper. It's in Alcohol, Clinical, and Experimental Research. I think that's an important paper. What he has done is shown the cardioprotective mechanisms from alcohol over here. It decreases platelet aggregation, inhibits the inflammatory markers, it induces your good enos, nitric oxide that improves endothelial, anti-diabetic, and so forth. And then on the left side, they have shown some of the mechanisms, molecular mechanisms that affect homocysteine, sodium disulfide, adenosine. All of these are the mechanisms there. And if you want a really good review of what's happening, go to earlier this year, Alcohol, Clinical Experimental Research by Collins that shows these effects. Now, this is alcohol. Are there differences by consumers of beer, wine, or spirits? And we have a couple of things. This is another slide from Boisset. And the reason I'm showing this is because there are separate genes, receptors, that are affected by alcohol, and in this particular study by two other polyphenols, which are catechin and quercetin. And this is not even resveratrol, but it does the same. But many of the polyphenols in wine we know that they work because they stimulate the activation of certain genes, and they're separate receptor sites for the polyphenols and for alcohol. So it can't all be just in the alcohol. It can't all be just in the polyphenols and wine. It's a combination. And I just think we are very lucky to have such a nice package for all of these polyphenols and alcohol. This is just showing the same paper from Collins showing the various effects of resveratrol and showing some of the mechanisms. So we won't go into that, but at least you know there is a source for this. Now, there's no question that moderate drinking decreases coronary heart disease. But if it made your head turn green or fall off, or if it had other bad side effects, you'd worry about it. So what does moderate drinking do to other diseases? Well, as has been shown by many in this room, it decreases ischemic stroke quite dramatically. As I showed, it decreases heart failure. One of the biggest things, it decreases the risk of diabetes by 30%. And for the first time, it used to be that if you had a patient who's a diabetic, the list of things you can eat and not eat, they left alcohol off because they didn't know what column to put that in. And now they're beginning to say that if you want to drink, you should really, if you are favorable to consuming some alcohol, you can have a dramatic effect on decreasing your risk of diabetes, as well as, even more so, preventing the cardiovascular complications. Metabolic syndrome, as I'll show. Here's the best news for us old farts, cognitive disorders. We used to worry about, every glass is knocking off another beta cell in the brain. Anyway, we have good news on that, as I'll show you. Here's one that, once we can advertise on the bottle that drinking this over 1 week will help you lower your weight. We can't do it yet, but there's emerging data strongly suggesting that obesity, we've always seen that. The drinkers are always leaner than the abstainers, and we didn't know why, and we still don't know why, but the data are beginning to support this. Infectious diseases, it's been known for a long time. In fact, that's why you had to drink wine in the Middle Ages to kill the bacteria in the water, and no word on the swine flu as far as I know. Here's a big thing that we're worried about, and I'll mention that one. But let me just mention the glucose metabolism, because I think that's extremely important. Important papers in the last couple of years, Ahmed et al. Followed diabetics, 38,000. This is an Arthur Klatzker's study, showed that drinkers up to 3 per day had better control of their diabetes. They had lower hemoglobin A1C, which kind of measures how your cruising altitude is for glucose. Then Buehlens looked at type 1 diabetics and found that they had considerable reduction in retinopathy, neuropathy, and kidney abnormalities, the small vessels. And as in many of these studies, the people who were on wine who consumed wine had the best effects. This just came out, I saw it last Sunday, so I just grabbed this in the last minute and put it in. This is a meta-analysis of studies looking at alcohol and the metabolic syndrome. They said, comparing men, they said moderate drinkers up to 40 grams a day. That's 3.5. We're getting up there, guys. Women only get 20 grams a day to be moderate. And you'll see that the overall effect is a reduction, small reduction, 15-20% in metabolic syndrome for men who are moderate drinkers, and about a 25% reduction for women who are moderate drinkers. So finally, we're getting some randomized controlled trials, and this is what everyone wants. Houston did a nice randomized trial showing that comparing white wine and grape juice, 36 postmenopausal women, and he found that if you gave them 2.5 drinks per day, if it was wine, it improved the insulin sensitivity, improved the adiponectin, which is a beneficial thing, and improved their lipid profile. Now, this is the one that I think got a lot of publicity. This is Shai and her group in Israel. They had a number of diabetics who were abstainers, non-drinkers. And they said, would you be willing to take part in a trial? And they gave them a glass of something to drink, and half of them got non-alcoholic beer, and the other half got 5 ounces of wine per day. At the end of 3 months, those who were given wine had lower fasting blood glucose drop from 140 to 118 with no changes in beer. So we're beginning to get the clinical trials to see. They worried about side effects within getting people in. The wine group reported increased ability to fall asleep, which was significant. And they also reported increased sexual desire, which is not, well, I don't know if the desire was not significant. Statistically, the difference was not statistically significant. Here's the good news. The association of alcohol and wine with Alzheimer's disease and with dementia. This is a meta-analysis from Peter's 23 cohort studies. And again, it's all these studies, and you can see that the tendency is for the estimates to favor, as it says, favor alcohol consumption versus being increased. And the average was about a 37% reduction in the risk of Alzheimer's for people who were moderate drinkers. And then another study from Melig. This showed a big difference. This is a 34-year follow-up in Sweden among 1,500 Swedish women. Followed them for 34 years and found that the dementia occurred. If you're a spirits drinker, it was increased. If you were a wine drinker, included wine, it was decreased. And if you drank only wine, dramatic decrease. We're beginning to get some data to support, Serge, what you have shown in Nancy and other places, that the dementia and shown by Orgogozo and Bordeaux, that wine seems to preferentially protect against the development of dementia. Now, the summary of all of this is that we don't, you've got to eat and you've got to walk around. You've got to do something. It's not just wine. You can't, be a complete slob and have someone run a tube with bringing wine into your mouth every day and expect to be healthy. It's a healthy lifestyle. And the thing that we're trying to get across to the U.S. government, regulatory agencies, to the public is that wine can be a component of a healthy lifestyle for most people. Now, this you'll be hearing from Morten Grønbæk tomorrow, and he's from Copenhagen. He's particularly pointed out how other lifestyle factors are associated with the relation of alcohol drinking with cardiovascular disease, and diet is important. As moderate drinkers tend to eat a healthier diet, and that's the confounding problem. And I just wanted to say that this morning, the most famous Dane I knew was Morten Grønbæk. But as of 5.5 hours ago, we have another one, another Dane. Today's winner of the 12th stage in the Tour de France, if you haven't been keeping up with that, was Denmark's Nicky Sorensen. So you've got competition for being the most famous Dane. We're up to date, Ted, as of 5 hours ago. Diet is important. And I think a lot of what we know about what is a healthy diet comes from Ansel Keys and the 7 country studies, and then particularly from Serge Renaud when he began to take these data and bring them up to date. The 7 country study, very briefly, they took healthy men, recruited them in these 7 countries, including in Greece, a cohort in Corfu, and particularly one in Crete. And they did everything they could do, and they followed them for over a minute. They're still following them if they're still alive. And after 10 years, they looked at the 10-year coronary deaths per 100,000 according to the calories from fat. And they said, oh, look, it's a straight line. And everyone jumped on the wagon. Low fat, low fat. The whole industry builds up of low-fat foods. What they didn't pay attention to was that the highest fat was in East Finland. They had terrible death rates, and in Crete. They had no deaths. No new deaths occurred in the first 10 years from coronary disease. Huge, huge difference. And they're all eating 41% fat, so what's going on? We have since learned that it's not the total fat, but it's the type of fat. And they said, well, what's the difference in these 41% fatters in East Finland and in the United States and the Netherlands are right in the middle there. So what's the difference in these guys at the top and the bottom? And said they're eating a different diet. They were smoking the same. Their exercise was about the same. Everything else they could do. The big thing, as Serge well pointed out, was the Cretan diet. They were, they were eating lots of fruits and vegetables and whole grains. Whole grains. It's been difficult to get the Americans into whole grains. Although I did find this quote. I don't have the source of it. The whiter the bread, the sooner you're dead. But the other thing the Cretans were doing is they didn't have a big 12, 16-ounce steak. They didn't have a big slab of meat. They had the dish had a little bit of meat or a little bit of fish, a little bit of something mixed in, but they didn't have these big slabs of beef. And again, I have a quote from Bill Roberts saying, "We fatten our cows and pigs, kill them, eat them, and then they kill us." And so I think that as we get into a healthy lifestyle, not so much meat, more fish, a little more chicken and all that, but make sure you include wine as that. Incidentally, in the Cretan group, after 10 years, one man died of a heart attack. What's different about him? This is one guy that died from a heart attack after about 15 years of follow-up. What? He was the butcher in the village. He's the only one that could afford enough meat to have a heart attack. This is the modern version of the Mediterranean diet. You can see that, we should have lots of fruits and vegetables and grains and all of these things, good things, a little fish and seafood and cheese and yogurt. And you'll notice right over here that unless there's contraindications, wine in moderation is indeed an important part of the healthy lifestyle. Now, here is how the people at Harvard, a group of studies, they've been following hundreds of thousands of nurses and health professionals and physicians for decades, and they found in all of their studies almost the same thing. If they have people who don't smoke, are lean, exercise, eat a low amount, this is a Mediterranean type diet, and consume a little bit of alcohol daily, they have 90% lower risk of diabetes. They have 80% lower risk of coronary disease. You can pretty much wipe out the need for cardiologists if you could get everyone in the country to follow these components of a healthy lifestyle. And just to update this, this was another report from 2008 from Call, where they evaluated the lifestyle, and they had 4 key factors. One is a lot of fruits and vegetables, which is very important. Physically and being a non-smoker and so forth. But moderate alcohol is a component, and every healthy lifestyle paper that's come out in the last 2 or 3 years that I've seen includes moderate drinking. Never before. It's now coming into it, and as it should. In this particular study, when they looked at that, if you follow all of the lifestyle, your survival rates are much higher for the people who have all 4 health behaviors, and if you have none of the health behaviors, down the chute. So much higher mortality. One other study on the Mediterranean diet where they looked at, this is from Mitru, and they defined it as fruits, vegetables, low intake of dairy, and some alcohol, and they found that if the people who are the highest Mediterranean diet, cardiovascular disease, cancer, and all-cause mortality, were all reduced to 20, 25, 15, 20%. So we now have lots of data supporting that. But here's the key, and I want to take just a minute on this slide. We okay, time-wise? All right. The effects of alcohol on the risk of myocardial infarction by other lifestyle factors. This was a group of the health professional study. And the people who are the least healthy, these were those 5 components. These people were obese, they didn't exercise, they had a terrible diet, and they smoked. So they had none of the healthy lifestyle, only one. And their rates of having a myocardial infarction were 550, 600. Now, if they had all 4 of these other factors, these are lean, non-smoking, exercising, healthy diet people, dramatic decrease from almost 600 to 50% reduction. So you should follow the other components. But what happened to these healthy people if they also consumed a little alcohol. And look at this. Risk of myocardial infarction drops dramatically if they're drinking 1 to 2.5 drinks a day. Dramatically. As soon as you add alcohol, there's a further drop in the risk. Now this I think is the key, that alcohol not only should be a component, unless it's contraindicated, should be a component, but it is an important component in our Western societies where coronary disease and stroke and dementia and so forth are such problems. Now, it turned out this is there's nothing new under the sun. They say, look at this quote. This is from Thomas Jefferson. More than 200 years ago, I have lived temperately, eating little animal food, vegetables. I mean, he was on a Mediterranean diet in 1775. I double have what the doctor's recommended glass and a half of wine, and even treble it with a friend. So, I mean, I think no wonder he was such a good president. Are there not adverse? And I can't end without just saying, obviously we worry about intoxication and accidents, fetal effects, drinking during pregnancy, alcohol dependence, liver disease, and cancer and we worry about older people. They say, geez, well, if most of the deaths are in older people who are drinking, what about, they're going to fall down and break their hips and everything. So it was nice to see this study that just came out from Berg. This is the hip fractures. And if you drink up to half a drink a day or up to 1 drink per day, everything shows fewer hip fractures. There's a 20% reduction in hip fractures for people who drink 1 or more a day versus non-drinkers. Why is that? Well, they're not drinking enough to get tips and fall and break, but also it's improving it's decreasing osteoporosis. The bone mineral density is increasing with that. Now, if you start drinking more, less protection, and if you drink a lot, you see the risk goes up. I'll mention pregnancy just in passing because we've always known, and if you go into a restaurant in Walla Walla and obviously pregnant and pick up a glass of wine, you may get your wrist slapped, arrested, and the data in the last 2 years are not showing that. They looked at for adverse effects from binge drinking, and for isolated episodes, binge drinking even, it is important to avoid. They didn't find any adverse effects, and they said it is important to avoid inducing unnecessary anxiety. Particularly, we have women coming into the doctor saying, "Oh, I didn't know I was pregnant, and I had 4 drinks last night. Do I go get an abortion? Have I ruined this child?" And I think there's a lot of unnecessary anxiety. And then Kelly's paper came out. 1 to 2 drinks per week were not associated with increased behavioral. And in fact, the risks were lower among the light drinkers than the women who didn't drink at all. The people who drank 1 or 2 drinks per week actually had brighter kids at 3 years than those who hadn't drunk at all. Now, this may well be just unadjusted confounding. These people were doing other things good. But it stimulated a lot of anger among Colin Gavahan, who is actually in the School of Law, an ethicist, who wrote a paper, just came out in the Journal of Medical Ethics, entitled, you can guess, "You Can Handle the Truth, Medical Paternalism and Prenatal Alcohol Use." And he just said, he's referred to the Kelly study that we just saw. It raises the question of what information we should be giving to pregnant women. If the best evidence is that low-level alcohol consumption presents negligible risk to the fetus, then respect for autonomy means that such information should be communicated to pregnant women. Tell them the truth. So that, we're not encouraging people to drink during pregnancy, but if you have an occasional drink, you should be reassured that there's very, very little evidence of harm. And this one study may be some benefits, but I'm not advertising that yet. Liver disease, you're going to be hearing about that tomorrow. Jabo showed that while heavy drinking increases liver inflammation and leads to cirrhosis, regular moderate drinking, both in patients and in rats, decreases inflammation, and you'll be hearing from the co-author of Dunn about non-alcoholic liver disease tomorrow. The big question is the big C, cancer. Allen did a real disservice when he and his group published the Million Women study, I think, because they they frightened the death out of women by saying that a single drink a day will lead to throat cancer. Now, how did they get that conclusion? There were, 90 number of cases, and a small number. But they did a linear analysis, and they said if you don't drink, you never get this. If you drink 10 drinks a day, you get this, and they drew a straight line. And so they said, well, that straight line goes up. But that's not the way it works. People do not get larynx and oral cancer and even liver cancer from small amounts of alcohol. They get it from heavy, but there's a threshold that we see that leads to these diseases. So they unnecessarily, I mean, the headlines, you see a woman afraid to drink. Before you sip that Chardonnay, make sure that you're not increasing your risk of cancer. Now, this is the kind of the pattern. You can see that here are the important ones, breast cancer and rectal cancer. These are the common ones that we worry about being related to alcohol. And then there are some like thyroid, non-Hodgkin's, renal cell, that are actually decreased among moderate drinkers. Is wine any better? Well, in this particular analysis, which was not a good analysis, and I don't think we should make too many conclusions, but you'll see that those who drank wine, this is wine exclusively, had a lower risk of oral cancer than those who drank other beverages. A little bit of an effect, but not a dramatic effect. So it looks like, if you're going to be drinking a lot, you're not going to necessarily get protection if it's wine. But I think it is important to realize that a number of studies looking, this is Barrett's esophagus GERD, which we all get at times, leading to esophageal cancer. 3 studies came out at the beginning of this year showing for wine drinking reduced rates, sometimes cut in half, for Barrett's esophagus and esophageal cancer. And that they say this was actually an editorial say this is by in gastroenterology that it's important that we realize that. So let's do moderate drinkers live longer? And we've known this is the million-man study of the American Cancer Society in the U.S. There's this U-shaped curve. If you don't drink, you're up here. If you drink a little, your risk comes down about 20%. Because you're bringing down your cardiovascular diseases and you don't start getting the alcohol-augmented causes of death until you get later. And the more recent one is showing the same J-shaped curve. A little alcohol tends to decrease the total mortality. A lot increases it. And Serge showed many years ago that if you're going to drink a little bit, make sure it's wine. These are the triangles. Big drop in your risk of a total mortality if you're a wine drinker. If you're a mixed drinker, a little bit less, and if you drink just beer, you don't get much protection. And a new study that just came out this year from the Zutphen study, this is kind of interesting. This is the survival after age 50. If you are a no alcohol user, this is the dotted line. Let's look at the 50%. This means that half the people are going to be dead by the time they're 71. If you're a beer or spirits, you live a little longer. If you're a wine drinker, half of them are still alive at 82. So there is definitely accumulating evidence showing that wine drinking is preferable. Now, should physicians prescribe moderate alcohol intake for abstaining adults? What happens if someone starts drinking as an adult? Now, every paper you read from the government, the end say, but this does not mean that non-drinkers should start drinking, and this will be coming up during the meetings. What data do we have? Well, you've already mentioned the ARIC study. Over 6 years, a few people began to drink moderately, and they had 38% lower risk of cardiovascular disease than did their persistently non-drink. So these are observational data, but it is showing that it's in the expected direction. Powers, this is a huge study in Australia. Those who remained moderate drinkers continued to have the highest rating of health, and those who stopped drinking during follow-up showed a decrease in their ratings of overall health. Now, we don't know why they stopped. That's the problem. This is not a trial. So these are just informative things. But I did over the weekend go through, I'm writing a paper now about changes in alcohol in the Framingham study, and this is preliminary data, not to be quoted yet. This is the early adult versus later adult drinking patterns in Framingham. This is the early, these are the non-drinkers. This is before age 50, or if they didn't have data before in 50, we did 40 or 60. But before 40 to 60, this is the early drinking pattern. And the non-drinkers, there are 1,000 of those. Mainly women, but not all of them. 1,000 non-drinkers. What happened to them as they got older? Guess what? Half of them started drinking. How much did they drink? Did they go down the slippery slope into abuse? Boom, boom, boom. Almost no one patient consumed an average of more than 3 drinks a day. So in other words, the non-drinkers, half of them remain non-drinkers for the rest of their lives. These people, about 65% have already died, so it is their lifetime exposure. If they do start drinking, they drink very, very modestly. If you're a heavy drinker, 350 were heavy drinkers when they were younger, and about half of them stayed there and the rest of them came down. If you're in the middle, you go both directions, but there's a tendency from wherever you start, here's the keeping the same thing. And this is 7,300. So we're hoping to finish this paper shortly to say that, again, observational study, but people who begin to drink in adult life do not necessarily go down the slippery slope to abuse. Are there contraindications? Obviously. If someone has had alcohol or drug abuse, or is underage or pregnant, certain liver diseases, and if it's against their religion, you're not going to encourage them. But this, I think, is the most common sense guideline that has ever, for non-drinkers, has ever come out. And this is from the report on sensible drinking from the Department of Health in the UK in 1995. And Richard Harding, who was one of the authors of this, we can describe the excitement of getting this through and defending it. What do you do about non-drinkers? They said, well, some people who do not wish to take up drinking for religious, other reasons, or maybe medical grounds, here's the key. Middle-aged or elderly men and postmenopausal women who drink infrequently or not at all may wish to consider the possibility that light drinking might benefit their health. This is the first government agency that I know of that is actually coming and said, guess what? Maybe we should be encouraging it a little bit more than we have been doing. Current challenges, middle-aged and older adults who have no contraindications to alcohol, we can encourage intelligent drinking, whatever that means. I mean, you don't drink if you're getting ready to fly an airplane or drive a car, and it means that you're not going to chug-a-lug that whole bottle. However good the wine is, you don't take the whole bottle at one night by yourself. And I think that we should, the key other thing that the black eye that alcohol gets is the drunkenness. And we somehow have to make make drunkenness socially unacceptable. You know, if there are various ways of doing this. I remember the Aristophanes play, to stop the endless Peloponnesian Wars, the women of Greece issued an ultimatum. Guys, no sex until you stop fighting. So no sex if these drunks, if we get, well, I guess both the girls and the boys are getting drunk now. But I think that it's important that we think of cultural ways to make drunkenness socially unacceptable if we're going to get that black eye away from the alcohol and health. Let me end with a poem that makes a good point, I think, about drunkenness being unacceptable. It was given to me by actually a minister who had seen it written on the wall of a pub. It turned out it was a song written by Clark Van Ness. It was an evening in October. I confess I wasn't sober. I was carting home a load with manly pride when my feet began to stutter and I fell into the gutter and a pig came down and lay down by my side. Then I lay there in the gutter with my heart was all aflutter till a lady passing by did chance to say, you can tell a man that boozes by the company he chooses. And the pig got up and slowly walked away. Thank you very much.